Hi, everybody, and welcome to Practice Habits. I'm Matt Jensen, and I'm glad that you're back. This is one of many sessions we have almost weekly as part of a way, frankly, in my mind, to give back. Having run a practice in the Upper Mid and Mountain West, we had to rely on a lot of people like you to learn how to implement new things. And now there's a little bit of a role reversal. As new technologies come out, we want to be a place where you, as practice leaders and doctors, can find new information, but also learn how to implement it. And today, I'm joined here by my friend, Dr. Patty Buehler. She is the founder and CEO of Osheru, who has a new product out called Ziplyft. We're going to talk about all of that today and just have a nice discussion. Dr. Buehler, one of the things that happens is people will just unmute and ask questions or participate. It's a really casual conversation, but it's really an opportunity for you and I to just discuss what you've been doing over the last year, because my goodness, quite a progression. Maybe before we get into all of the slides, give us a sense of what Osheru is and what Ziplyft is.
Sure, Matt. Well, thank you for having me on the program. I really appreciate it and the chance to share information about Ziplyft. Ziplyft actually came about because I'm a cataract refractive surgeon, but I've always done eyelid surgery as well. And when you're a cataract refractive surgeon, the efficiency of LASIK surgery and cataract surgery is such that it makes you think a blepharoplasty takes an awful long time. And you have to deal with cautery and bleeding and suturing, which is kind of tedious when you're a cataract refractive surgeon. I wanted to make the procedure more efficient and better for the patient as well as better for the surgeon. And so in 2020, during the pandemic, we started to develop the product Ziplyft, which makes blepharoplasty, upper lid blepharoplasty easier for the patient and the surgeon. And it's a very efficient process that has no bleeding, no need for cautery, and no sutures. And that started about 2021. We really got going, and we won Eyecelerator for Best Early Stage Company. We won the next year at Eyecelerator for People's Choice Award, and the product was just released this March, so just a few weeks ago, for sale to surgeons.
Yeah, and it's a really clever device. One of the things we're going to talk about is how it's brought some more elective revenue back into the clinic. You know, having run a practice, we know that I knew that we had a lot of opportunities to grow revenue in the ASC. Harder to do that in the clinic. Refractive is one way to do it. The refractive portion of cataract care is one way to do it, but it's hard to stay ahead of the costs. And yet, this is something that doesn't have to be done in a surgery center. We can pull it back out into the clinic. And I think that that's a really important characteristic of this technology.
Yes, and so the procedure can be done in the office, and patients can get a little oral sedation like Versed or like Valium if you want, and then they just get a local injection of anesthetic. And so it can be done in the office without a surgery center, and that's a big cost savings to the patient, of course, and a
Yeah,
hassle savings to the surgeon.
yeah, right. Cost savings to the patient, but also, I know that we like to keep our surgery center full with highly efficient procedures, and and when I say efficient, there's some business mindedness in that as well, right? There's some, can we pull in enough revenue in the same amount of time? Good news is a lot of cataract, a lot of, things we do in the ASC, cataracts and others are extremely efficient from a timing standpoint. We can do a lot more than we can do maybe a typical, upper lid blepharoplasty. Even if we're doing it electively, it might take longer because of the way we do it in the ASC. And so, it's almost like a 3 or 2 to 1 equivalent by way of total procedure count. And so in the clinic, we're not fighting for that space like we are in the surgery center, and it's uncontested, and it's an opportunity to bring revenue back. I want to talk a little bit
Yeah.
about some of the mega trends, and you just got done launching your product in Washington, D.C. It was a fun event. For those of you who weren't there, it was a Zip and Sip event. The product is called Ziplyft, and it was a cocktail hour wine event where they announced kind of the availability of the new product, which is Generation 3 and has gone through some fun studies. But it was also fun to have an oculoplastics surgeon there, a general ophthalmologist there who primarily does glaucoma, and to talk about some of the things we'll talk about. But I think that kind of just to step back, big opportunity in oculoplastics, right? Number of surgeons
Yes.
decreasing, number of demand, amount of demand increasing. Does this hold true to what you're seeing in your practice?
Yes, I mean, certainly there's definitely an aging population. We all know those trends. But since the pandemic, there's been a massive increase in the number of cosmetic procedures that are done from here up because people are on Zoom and Zoom calls and Instagram. And there's been a decrease in plastic surgery procedures from here down. So actually, blepharoplasty is up 39% since before the pandemic. And it has now surpassed liposuction as the most common done cosmetic surgery in the world. So there's a lot of procedures being done out there, over 2 million in the US annually. So the trend is that more younger people are getting the upper lid treatments, and also more men are getting the treatments as they are seeing themselves on Zoom and on Instagram and those social media sites.
Well, I'm definitely a candidate. I don't know if I qualify for the young part, but I qualify for the men part, and look forward to having that. This is something that, when we were together, we had talked about in Washington, D.C., which is just the difference between a traditional, blepharoplasty approach and the zip lift approach. And again, as a recovering, practice administrator, this is how I size things up. The doctors are always committed to doing the right thing for the patient. It's people like me and others on the call. Ty is here, and Michael and Ayad. We're responsible for making sure the dollars and cents, make sense for the practice. So over here on the left, there's hospital costs, ASC costs. There's bleeding in a traditional blepharoplasty, cautery sutures. 45 minutes is, I would say, a pretty consistent average, and then there's a long recovery time, right? Because we're doing a procedure differently than we do in this kind of approach with Ziplyft, which I'm going to ask you about because there's a fun acronym about it called COCO, which we'll learn about here. Meanwhile, over here at the Ziplyft treatment, it's in the office. There's no bleeding, no cautery, no sutures. It was 11 minutes. When we were at the event, doctors were talking about, is it really 11 minutes? I think I might be able to do it faster than that. And then, of course, the revenue on the elective side um, is right there. Maybe talk a little bit more about what you're seeing between the um, surgery center environment and the clinic environment, and how doctors look at the value of their time.
Yeah, and I think, it's just a lot nicer for the surgeon to be able to do this in the office. They don't have to go over to the surgery center, even if it is attached to their office, and get in scrubs and have a big procedure in a procedure room where the patient might have an IV sedation as well as the local sedation. And it's much nicer for the patient because patients don't generally like to go to surgery centers or hospitals or ASCs, and they love to do things in the office. They prefer not to get an IV if they don't have to have an IV. And so I think the patients really appreciate that that it can be done in the office quickly. So yeah, I think a person who currently does functional blepharoplasties, the reimbursement is low from Medicare for a functional blepharoplasty at around $700. It's more if you have your own ASC. You can get an additional $1,200 to $1,400 for doing it in an ASC. But if you do a cosmetic upper lid procedure, that's a cash pay procedure. So it's different economics for the patient and for the surgeon. Uh,
That's great. And the equivalent then on the zip lift side of things is, and there's the device right there, but it's much more, respectful of the surgeon's time, right? A procedural based, elective based approach. Um, Maybe walk us through that philosophy on the procedural price above, and then also the device featured over there on the left.
Yeah, so the device is really an ophthalmic clamp and an ophthalmic blade. And so the clamp mechanism does two things. It clamps the tissue so that it cuts off any blood vessels. So there's no bleeding and therefore no need for cautery. And then the blade slides across to remove the excess skin tissue. And then the device has sealed the tissue together so that it can then be closed with Dermabond adhesive, tissue adhesive, instead of using sutures. So by taking out the cautery, which takes a lot of the time of the procedure, and the suturing, which is tedious and takes a lot of the time of the procedure can be done in much, much less time. On average, our surgeons were getting the procedure done in about 11 minutes. Some of them faster and some of them not. But about 11 minutes, which is a big time savings for the surgeon. It's very efficient. It's also very easy to get into your workflow. There's not, you don't have to have many people in the OR. One assistant is plenty, and the patient is in and out of the office pretty fast. There's no need for suture removal, so there's no suture removal day, which also usually takes a little bit of time of the surgeon as well. And a lot of the complications with a traditional blepharoplasty are related to the sutures. They can get an allergic reaction to the ointments, which we don't need to use. They can have suture-related abscesses or little cysts. And so without sutures, it's a much nicer incision, much lower complication rate, and the incision is nice and smooth instead of being puckered. And it heals very, very fast. And very little bruising and downtime for the patient. So those have been some real highlights for the patient experience.
Yeah, and I'm going to have you just narrate through this. We've got a couple minute video
Sure.
that I think is going to be helpful for people to see because it really is impressive how this works.
Yeah, so this is a patient of one of our oculoplastic surgeons in our pilot study. This is a 45-year-old white female. This patient has been marked with the marking pen as you normally would for a blepharoplasty procedure. So you mark all the tissue you want to remove. We use this little forceps, which is called a green forceps that we've modified, and you can pre-pinch the skin. Some people know this as a skin pinch, but you're kind of pinching and sealing that tissue together so that the purple marks on the top are meeting the purple marks on the bottom. So she's doing a little bit of pre-pinch. And then we also have her mark the forehead so that the device can be put on symmetrically on either side. Right now, she's using a little device that's called a Zip Assist, and that just grabs the tissue and holds it for you. So you can actually do it without an assistant if you want to. So she's just getting that in place, getting all that excess skin through the device. This is just the Zip Assist device on one side, and then she'll do the other side as well. Here's the Ziplyft device itself, and she's pulling all that excess skin into the device and then closes and locks the device. And that creates the pressure seal that cuts off the blood vessels so there's no bleeding and no need for cautery. And again, you're going to put the device on one side and then you have a second device so you can be sure that all the tissue that you want to remove is in the device and you can see it. Before you do any cutting, you can confirm that it's symmetrically placed and you have the right amount of tissue on each side. So here, the surgeon is getting ready to slide the blade across and remove that excess tissue, and doing the same on the fellow side, initiating the cut and then sliding the blade across. So now that excess tissue is getting removed on the right side. And once it's removed, we usually have you wait 2 minutes and then dry things off because Dermabond likes to have a dry surface. So we dry things off. We remove the devices from each side and then dry it again. And we apply the Dermabond above and below the incision itself. So that little plastic disc is still in place, holding things together so you don't have to have an assistant. The Dermabond, we put nasally to temporally to get that in place. And it takes about a minute or two for the Dermabond to dry. Then we
Wow.
just remove these little plastic zip assist pieces and dry things off. The patient's all complete. You can see there's no bruising above or below that incision, and there's very little swelling. And in our split face study, there was very remarkable difference between the two. Here's an incision at 3 days. So you can see there's still a little bit of adhesive there at 3 days, but here's at 1 week, and you can see those lower incisions are beautiful. They're smooth, no puckering. So our oculoplastic surgeons are very happy with the incisions. Again, this is a set of 3 different patients going across 3 day. At 3 days, you can kind of see a little bit of purpley red where the adhesive has got a purple hue to it. And then by 1 week post-op, 7-day post-op, they look beautiful, no bruising above or below the incision. And the incision is smooth and beautiful at 3 months, almost invisible incision there.
Well, and this is so important. I've got family members who had cosmetic upper and lower blepharoplasties, and you know, I care for them and I love them. But when I first walked into the house and saw them, it was jarring, right? I mean, they looked pretty tough, like they had been in a fight, and it took a few weeks for them to feel like they could really be in public. Whereas this is just what I like to call, and it's not an approved term, but this is event ready, by next weekend, which is
Yeah.
totally new to think about in this category. So I think that that combined with the other thing that we in our program we found that oculoplastics work was scheduled out so far because we didn't have a person, that we finally decided that we needed to just start sending to another city, and so we would send to Omaha from Sioux Falls, and what this does is it allows us to keep as much of that as we can here because it kind of removes some of the technically complicated pieces of the procedure, kind of democratizes the oculoplastics piece, the surgeon piece. You still have to be a great surgeon, but I mean, it's not quite as complicated as doing it full blown in the OR with cautery and all of those things. Am I
Right. And I
saying
think you're
that
right, Matt.
correctly? Yeah.
Yeah. Mm-hmm. And I think event ready is a good term. So patients are often have a lot of fear about having a plastic surgery procedure on their face. They're worried about downtime from work and social activities. Sometimes they don't want other people to know that they had something done. And that's one of the beauties of our minimally invasive lid treatment with the Ziplyft is that we've had surgeons, ophthalmology surgeons have the procedure and they work the next day. And we have one office administrator who had the procedure, and that office administrator went and actually got married the next week. So it's definitely event ready. We still
Yeah.
want patients to ice and to take it easy, but they do look good a lot faster than a typical blepharoplasty.
Yeah, and maybe I'll ask this question, and people can find out more. This slide is advancing on its own, so I'm sorry that I wasn't trying to cut you off with that. But if the people want to learn more, this is how they do. We've got practice administrators on the line, and I think that what I keep coming back to is the market opportunity. These people will find us, because if we start to talk about it. Um, there's also all kinds of folks already in our database who have had this, who would be, a good candidate for this procedure, who we know, have droopy lids or maybe have tested to have things done in the past. This isn't a insurance reimbursable procedure. This is specifically designed for the elective pay, which is, I think, such an important piece of what we're trying to do in healthcare today is make sure that one part of our program can keep the other parts of our program solvent. Um, but
Yeah, absolutely. And I think, there's patients sitting in your office now that are coming in for their routine eye exams or their cataract evals or their glaucoma follow-ups, and they would be very interested in having something done about their lids. A lot of patients don't know that their ophthalmologist can do eyelid surgery, but they trust their ophthalmologist and they trust their cataract surgeon. And so if they know that you offer a procedure like this, they're usually very anxious to have it. We do have a lot of beautiful practice integration materials for practices. So we have a email letter they can send out to their premium lens patients. We have a letter they can send out to Medi-Spas. We have a training program for the staff as well as for the surgeon. And the way to get started is you can speak to the sales rep in your area from Osheru. And we'd like you to have 4 to 5 cases set up, and we come out and do a training with you on those cases. And after about the first couple of cases, you'll be very, very comfortable doing it on your own. And it's a great thing to offer your premium patients an opportunity to look younger and more confident.
Yeah, to look as young as you feel, right? They just
Mhm.
enjoyed a lot of them getting new vision. Now they'll enjoy also kind of seeing themselves in a new light. I want to just talk for one moment. You know, you've launched it in DC. It's quite a bit of buzz. Your booth was incredibly busy. I think what it would be fun is, you know, in a few months, let's call it 3 months, maybe late summer, to also have you back. And maybe with one of your team members or practice that's using it to see, you know, how did it revitalize the practice? How are they integrating it? Because I think that's a really important part as well. You know, some of the practices that already started, you know, they lined up their first 4 or 5 and they already have their next 4 or 5 ready to go. I mean, team, that's, you know, depending on how you price it, 40 to $50,000 of top line revenue. You know, that wasn't in your clinic before. And there's some material costs. The device itself, you know, carries a cost. But I find it just so refreshing that we have new things coming out like this. I want to just open it up now for questions. I know we've got only a few minutes left with you, Dr. Buehler. And so if anybody dares, Ty or Ayad, any questions that you have on look at that. I called on him and he jumped off before I could get him slippery on how it might work in your program.
Yeah, this is Ty. Thank you guys for putting this on. We're just getting a part-time plastics person, and so I'm going to bring this up as a possible way because he's going to be in the clinic 2 days when he's here a month, and then doing surgery another day. And his surgery day, I think, is going to be very full. So if
Yeah.
there's a way to minimize, do more stuff in the clinic, this would be a great way to do that. So I'll bring it up to the team.
You know,
Yeah,
it's
that'd be
interesting,
great.
Ty. Sorry, Patty, I'll let you, Dr. Buehler, you can respond to that too.
I was just saying, yeah, it's definitely something that they can do in the office. And again, I don't think it takes away from the standard oculoplastics procedures they're doing, or even if they're doing, you know, upper and lower blepharoplasty with a brow lift and laser, they'll have patients to do that on. This is really for the patient who is a little younger and would like the excess skin removed without a lot of downtime. And I think that's a special niche that's for this device. So I think it's a practice builder. One of our oculoplastic surgeons thinks it's you know, it's kind of a gateway drug to other plastic surgeries. And our oculoplastic surgeons that are in our pilot study, they really feel that the incisions look so much better than their sutured incisions. And these are talented surgeons that do a beautiful incision. But the Ziplyft incision looks much smoother. The patient much prefers the Ziplyft side when compared to the traditional blepharoplasty side. So patients really love it, and I think that there's a role for it in that younger population that wants to have very little downtime.
Well, and what I was going to add to that, Ty, is you know you have a lot of talented surgeons in your office. He's in northern Montana, Dr. Buehler, and great surgeons, and especially since you're getting an oculoplastics specialist, you know having them available to do some of the things that only they can do is so important, and they're going to be busy fast. The nice thing about this, and it's an internal decision for all of you, is this doesn't have to be the oculoplastic surgeon. This
Yep.
is something that everybody else can do in between when they're around. You know, and like we mentioned, there's some comprehensive ophthalmologists that are as part of the board and doing part of the studies, and it's kind of exciting that way.
The one question that I had that maybe it came up, but I didn't hear it was the cost.
Yeah.
Yes. The device, the Ziplyft device, it's actually a kit. It comes with a right device and a left device and those forceps. And pretty much if that's on the field, in addition to that, you need some Dermabond. And the cost of the kit itself is $1,400.
Okay.
And the
And
average price to patients, the average cost to patients of a cosmetic blepharoplasty in the United States is about $5,000.
Okay.
yep, that's how we um, pulled those numbers together, Ty. And the other thing I think is helpful is if you already have a sense of what your volume might be like. Patty's team has done a good job of building calculators on what it might cost minus the overhead expense of the device itself, so you can get a sense of the revenue model. But um, I think it stands to reason that you're profitable within the first procedure, right? Because each procedure, you're going to more than cover your costs. And that's also another thing that, boy, in the past, we've had to invest heavily in order to make sure that we can find things that we're electively profitable at. Dr. Buehler is doing this from her LASIK suite, right? And there's, 7 figures wrapped up in that room and the room next to it in order to get that elective spend. So, exciting times, Dr. Buehler. Thank you for sharing it with us. We look forward to more updates. And then this will be available on the Practice Habits site, and we'll post it on YouTube as well, in case you want to share it with family and friends and other people who might be interested in learning. Everybody, I want to let you know that another company that is doing some neat things, Brevium, launched a new offering in Washington, D.C. called Brevium Elite. And it's a software that helps find patients that maybe were lost to follow-up, but most importantly, it tells you what they're a good candidate for, where they are in their treatment algorithm, and matches them perhaps with the procedure that their payer is most apt to help in covering a portion of. That's going to be an exciting talk next week. And then the week following, we'll be talking to an executive from a private equity group on the East Coast on how they've implemented this technology and many others in an operations standpoint. Thanks for your time. We look forward to seeing you back here next week. And Dr. Buehler, thanks again.